Hi, I'm Todd Wegerski, and welcome to Back Talking, the show where we discuss all things related to the back or spine. Now, our goal with the show is to help you understand what is causing that back problem you're struggling with, how to treat it, and what everybody wants to know, how to prevent it from coming back again. So if you're suffering from back pain or know someone that is suffering from back pain, then this is the show for you. While there's no shortage of information out there about bad backs, be it some good and some bad, back talking is different in that you get me, a real life person that you can interact with via email or online through these video webinars that we run at our website, which is backtalkinghelp.com, where through webinar technology, you get the chance to interact with me weekly. You'll get the opportunity to ask me questions, and hopefully we'll provide some answers to help you, with those back problems that you're dealing with. Now, the title of this episode is Back Injuries. And in this episode, we're going to discuss the one reason, the one reason that backs get injured. But before I do, I just want to rewind a bit and review some of the key points that we talked about in episode 1, which was titled The Back Pain Epidemic. So without further ado, I'm going to jump into my screen share here. And let's see what happens. We're going to start the screen share and back injuries episode 2. Now, somebody's pulling a Charlie Brown on this poor guy. Love that picture, but I'm afraid to see what happened to that guy at the end. All right, so back pain, it doesn't discriminate. It affects the young and the old, women and men, and athletes and couch potatoes. Our modern lifestyle has many benefits, but still today, 80% of the population will experience back pain at some point in their life. And of those, 50% will have a recurrence of that problem every year. Now, back pain, it's the number 2 reason for doctor visits, second only to the common cold. It causes more disability than any other single medical condition in the world, with neck pain ranking number 4. Direct cost to treat low back pain, $102 billion per year. And when you add in indirect costs, such as disability, lost work days, lost productivity, that number approaches $200 billion per year. Now, what does this mean for our employers? Well, that cost needs to get passed on to someone. And for those who are employed and get their health insurance through their employers, that cost gets passed on to your employer and ultimately to you. And despite spending over $100 billion a year on treatment for back pain, Americans continue to struggle with this problem. It has become a national epidemic. Now, back pain is the number 1 cause of job-related disability in the United States. It accounts for 25% of all workers' comp claims. And back pain is the second most common reason to miss work, again, behind only the common cold. And the cost of back pain to employers is about $61 billion per year. And the average workers' comp claim for back pain is about $20,000. Now, what has led us to this epidemic that we face today? First of all, I think that there's just general confusion. We get advice from friends and family, but what has worked for one may not work for others. Now, who should I see? Should I see a massage therapist, my personal trainer, a chiropractor, physical therapist? How about an orthopedist, a neurologist, or an acupuncturist? The list goes on and on. And point number 2, mismanagement at the primary care stage. Now, there's been established guidelines that have been in place for well over 10 years, but they're not being followed, especially when it comes to imaging, invasive procedures, and referrals. And treatment directed at symptoms only through painkillers and muscle relaxers has been an absolute failure, as witnessed by the statistics that we talked about earlier. And in a major study, primary care physicians lack the clinical confidence to manage care appropriately and to supply best care practices for their patients. It's outside their realm of expertise. And it's also a low priority. Because it's not a life-threatening disorder, it doesn't get the attention as would cancer, heart disease, or diabetes. And point number 3, our modern lifestyle or screen time. All age groups spend as much time in front of a screen, either a computer, a laptop, a phone, or a tablet, as they do in bed. Adults over the age of 55 spend 6.6 hours in front of a screen. And the 18 to 24 age group spend 8.8 hours in front of a screen. And that same age group, 18 to 24-year-olds, 84% admitted to experiencing back or neck pain in the past year and lost more work days to it than those of their parents' generation. And point number 4, exercise rates. 80% of Americans are not getting the recommended 30 minutes a day of moderate intensity exercise or some form of strength training exercise at least 2 times per week. And point number 5, the obesity epidemic. And these figures are just very startling. 35% of adults over the age of 20 are obese. 69% of adults over the age of 20 are overweight or obese. 18.4% of 12 to 19-year-olds are obese. And 18% of 6 to 11-year-olds are obese. And 12.1% of children between the ages of 2 and 5 are obese. Now, when you read the literature or articles about back problems, they often state a statistic that 85% of back problems are of unknown cause and that a proper diagnosis just can't be given to the person as to the reason they're suffering from back pain. Now, this has led to the popular belief that back troubles are inevitable and just happen, despite there being an abundance of literature linking specific mechanical scenarios to specific tissue damage. But all injuries can be reduced to the following scenario. Tissue overload causes tissue damage, which may or may not cause pain. Again, tissue overload causes tissue damage, which may or may not cause pain. So let's run several examples and see if this meets our formula for what causes back pain. Let's say a slip or fall. You land on your butt. This leads to excessive loading on the spinal ligaments, causing them to tear or stretch. So there's damage, which then may or may not lead to pain. How about a disc herniation? Repetitive low back flexion leads to disc cartilage overload and failure, which causes damage and possibly pain. How about text neck? Looking down at a phone, a tablet, or some type of screen, it causes tissue overload or fatigue of the muscles and supporting ligaments, which causes damage and potentially pain. But we need to determine the key link causing the tissue overload. If we can recognize faulty movement patterns that, when repeated, can lead to tissue overload and injury, this is a key component to developing a successful corrective strategy. Sometimes the true culprit is not at the site of pain. For example, if there's loss of hip mobility, it will not be possible to avoid end-range lumbar spine flexion in a squatting movement. So here the culprit is the hip and the victim is the lumbar spine. Now, a good clinical exam, one that consists of provocative mechanical loading to specific tissues, will reveal those tissues that hurt, or at least will reveal movement or motion patterns that cause pain. And these type of functional diagnoses are helpful in designing therapies such as exercises and in developing less painful movement patterns. Once the cause is understood, it can be removed or reduced. Remove the cause. For example, in that lumbar disc herniation patient, they are usually flexion intolerant, meaning activities that bend the lumbar spine forward, such as sitting, are painful. We can teach that person the hip hinge, which will reduce movement of the lumbar spine to near zero, but will allow them to remove or reduce the cause of their discomfort. So remember that tissue overload causes tissue damage, which may or may not cause pain. All right, and into our next slide. Now, very few injuries result from a single event. More commonly, there is a cumulative trauma pathway leading to the culminating event of a back injury. Because that culminating event is falsely presumed to be the cause, prevention efforts are focused on that event. And this misdirection of efforts fails to deal with the real cause of cumulative trauma. Now let's discuss the graph. Now, injury or failure occurs when the applied load exceeds the failure tolerance or strength of the tissue. So on this graph, this horizontal line right here, failure tolerance, above the line, it's going to lead to injury. Anything below, we're okay. Now in this first loading cycle, we are below the failure tolerance of the tissue. We have a margin of safety, and we are okay. But in the second loading cycle, the applied load increases in magnitude, which simultaneously decreases our margin of safety to zero, at which point we have failure and injury occurs. But in my experience, very few injuries occur in this manner. Examples of an event of this type are like car accidents or slips and falls like we just talked about. But more commonly on this graph, injuries during like occupational and athletic events involve cumulative trauma from repetitive sub-failure magnitude loads. So for example, let's imagine a person moving boxes from one room to another. Again, above this failure tolerance line, we have an injury. If we stay below it, we're good. But in this scenario, the individual experiences a slow degradation of failure tolerance. We see this failure tolerance line decreasing. And as tissues fatigue with each cycle of the load, and correspondingly the failure tolerance lowers, the margin of safety eventually approaches zero, at which point the individual will experience an injury. And in our next graph, yet another way to produce injury with a sub-failure load is to sustain stress constantly over a period of time. Now for this example, all we need to do is picture a person sitting slumped in a chair in front of a computer with their poor posture, with their neck sticking out. Now under sustained loads, the viscoelastic tissues, like ligaments and discs, they deform and they creep. And this results in a progressive reduction of tissue strength, which if left unchecked, it's going to lead to tissue failure. So again, we see a sustained load. The failure tolerance over time is decreasing, and our margin of safety is decreasing to zero, and we have failure and injury. And in this last graph, we can see an injury prevention strategy. And as we saw in the previous graphs, with each repetitive cycle of the load, the failure tolerance of the tissue is decreasing, as does the margin of safety. But if we add in a rest period, this will allow the tissue to recover and increase in strength, so to speak. So take a break, take a walk, Get away from the computer for 10 minutes. Get out of that chair if you're sitting. Give the affected tissues a chance to recover. Now again, I just want to reiterate, if you remember only one thing from me today, it doesn't matter if you're sitting at your desk in front of a computer all day, that upper back pain you're dealing with is due to tissue overload, which causes tissue damage, which may or may not cause pain. If you had a truckload of mulch dumped into your driveway yesterday and you spent the day spreading it around, that lower back pain that you are suffering from today is due to tissue overload, which caused tissue damage, which may or may not cause pain. Now, every scenario you can think of can be filtered through this statement. And finally, just in summary, back pain affects 80% of people at some point in their life. It's the number 2 reason for doctor visits and lost work time. And costs to society are about $200 billion a year. Our modern lifestyle, screen time, sitting, obesity, lack of exercise, and medical mismanagement has led us to this epidemic that we see today. Still being treated with pills, still being treated with pills, it's a failure. Tissue overload, tissue damage may or may not cause pain. So find the cause. A good exam with provocative testing will expose the injured tissue. Take it a step further in that exam and incorporate a movement screen, such as a functional movement screen, the FMS, or the Magnificent 7, to find the true culprit of the tissue overload. And from those graphs, we see that tissues are affected by loading, but incorporating rest into the scenario, we can learn to prevent injuries. So again, contact me. My website is backtalkinghelp.com. Come check out some previous episodes and the schedule of future episodes. Again, at backtalkinghelp.com. Subscribe to our podcast, which is called Back Talking. It's on iTunes or Stitcher. Or more importantly, you can email me. My email address is todd@backtalkinghelp.com. Again, that's todd@backtalkinghelp.com. So again, I look forward to hearing from you, and thank you for joining me today on Back Talking. Again, any communication to me is confidential, so no worries there. But reach out to me. I want to hear what you're struggling with and what troubles you're having. And I look forward to hearing from you, and I'll see you next time.